Today we're going to discuss how to correct inner thigh defects due to liposuction. I'm going to walk you over a case that I treated more than a year ago, and these are her results that we will show you a year out. This was a two-stage procedure. Unfortunately, more than one procedure was required in her case, as the extent of the defects was quite significant. And I wanted to walk you over to see how to identify those defects and also how to correct them. So let's go over the photo here, which is the first picture that I took of hers, and the arrows there are highlighting the defects that we are looking at right now. So let me just walk you over what these arrows they mean. The white arrows, they're pointing at different indentations along the thigh, and there are on both sides, but I just put them on one side here. Over here, this dark mark, it represents equally on both sides. That is the insertion of the cannula, and this was actually done by smart lipo or laser assisted liposuction. So there is a little bit of a burn mark over there, and this is the track mark. If you track it down, you can actually identify where the cannula kind of went in. And this is it's a very, very deep defect. On this side is a little bit more marked than it is on this side, and this is an area of a pocket that is protruding out. Then there is a linear defect on both sides. Then you have more indentations all along the inner border of the thighs. And they are uneven on both sides, as you can see. The total thigh girth is also different on both legs. If this is the orange arrow that represents the girth on her right thigh, and this is a replica, an exact size of the orange arrow on the other side. As you can see, it falls short, and the actual girth on the left side is a little bit wider than it is on the right side. And these red lines, they represent her outer silhouette of the thighs, which actually became more bow-shaped as with time, because as you can see, it's actually touching a large part of the red arrow as it kind of goes down. It should have been like a straighter line as opposed to a kind of outer bowing of the leg. Now, this type of a bowing of the leg is a kind of a thing that happens sometimes when, especially after liposuction, if the liposuction was done mostly on the inner thigh and on the front of the thigh, and not much attention being paid to the outer thighs. So over time, when people, they gain a little bit of weight, they gain weight on the areas where the lipo was not performed. So in her case, it kind of happened on the outer thighs, and it created a little bit of an outer bowing of the shape. So if you look at her completely, the entire thigh section here is more rounded as opposed to being long and linear, and this space is also quite uneven. So there are multiple things that are going on that we had to fix. So let me just show you her results after 2 sessions. And as you can see, these defects, they were corrected, and I was able to match this to the inner thighs. These all got better, as you can see, and also we worked a little bit on the outer thighs here to correct this bowing. And now the legs, they are shaped a little bit more linear. The inner thigh gap is much more streamlined, and it is even, and we don't see those protuberances close to the buttock area all the way at the top of the inner thigh. Those are gone, and both sides, they look, the thigh circumference is also matching as close to 100% as possible. And the scarring that happened as a result of the laser liposuction over here and the skin darkening, we did a few laser treatments to actually get rid of some of the skin darkening, and now she's managing it with some topical skin lightening agents, and I'm sure that over the next few months or so it will completely even itself out. But this type of a scarring can occur as a result of burn or heat coming from within the skin that causes some pigment changes. So most of her changes were reversed, and we were able to give her smooth shaped legs. So I hope you enjoyed this video, and I hope that you can learn something from this side. The inner thigh defects are very common, and we get a lot of calls from patients, those who suffer from this kind of a problem, but they can be fixed. So